Okay, here's the knee. Taking a look at this, we got the patellar tendon, patella itself, which is the kneecap. That's that bone right in the center of the knee. You got the patellar tendon. There's that medial collateral ligament. And on the other side, you got the lateral collateral ligament. Right there. Now, when you bend or flex the knee, if you see that blue sponge right in the center there, that's the cartilage. And there's that lateral meniscus. And on the other side is the medial meniscus. What this does is it prevents the two bones from grinding on each other, which is really important for when you're bending and straightening your knee. Prevents arthritis and helps for the cushioning. In the back there, you could see, make out the ACL. The ACL is what prevents the hyperextension of the knee. A lot of athletes injure this ACL when they get hit from the front of the knee, and that causes a hyperextension. When you bend the knee from the inside, you could actually see the PCL. That helps prevent hyperbending or hyperflexion. It's a less common injury, but it does occur. You could see on either side when you bend or flex the knee, you see how all those structures kind of move and groove together. So comparing the knee to the knee model here that we have, there's a couple things that you can make out. The first thing that's important is you can see the knee cap. You can make this out more clearly if I put the knee model actually on top of my knee. You could kind of see it's like a mirror image. As I bend and straighten my knee a little bit, that kind of shows you how the structures move. All right, so if I want to do palpation assessment, first I want to try to move my kneecap. Feel if it hurts, feel if there's any tightness in there. You could see kind of on the model as a comparison. What I want to try next is to put some pressure kind of on the kneecap itself. Then I could put some pressure above the kneecap. What that helps to do is helps the knee straighten. Then I could put my hand below the knee and put some pressure straight down through there too. This also helps to bend and straighten the knee. So these are manual therapy techniques that are used regularly by physical therapists to help improve mobility. The last part, you could see that fibula bone, that's along next to the tibia. If you work on pushing that up and down, that also will help with getting some extra bending in your knee as well as some extra movement in your ankle. You could feel and palpate for that as well and just push straight down. This is another great technique that's used in the clinic. So you could do these manual therapy techniques as kind of a preparation prior to doing these exercises. The great thing about that is that the muscles in the joints will be loosened up a bit, and that will help to get a little bit more pain-free movement and help you to do exercises a little bit better and with a little bit more strength and endurance and power. So I would give these a try. Now I'm going to show you some exercises you could do for the knee. So the first exercise I like is a standard knee press with a band. You could use a standard band. They come in different strengths. This is I'd say a medium resistance, pushing straight down through your leg. You could also wrap the band around your other leg and also kind of do the opposite motion, which is pulling up. This would be like a hip flexion with knee flexion. Then you also don't only want to work the knee, but you also want to work the ankle. So this would be working on pushing the gas pedal down. This is ankle plantar flexion. This would be ankle inversion. Great exercise for working if you're a runner. Work on stability of the ankle. This is for ankle dorsiflexion. This helps you when you're swinging your leg to help swing your leg over the ground and help prevent from dragging. And this would be ankle eversion, also helps with preventing from shuffling and dragging the leg on the ground in swing phase. So that was some education on the anatomy of the knee, some exercises, as well as some manual therapy. So give it a try, and if you have any questions or concerns, you could always reach me at 845-393-4506. This is Dr. Steve Roberts with Combat Sports Physical Therapy.